The purpose of this demonstration video is to highlight the main features of Arjo's Maxi Sky 2 series of ceiling lifts. Maxi Sky 2 is designed to assist caregivers in hospitals, nursing homes, long-term care and home care environments. This device is designed to lift patients with reduced mobility for the following reasons: transferring to or from adjacent location, such as chair, wheelchair, bed, bath, toilet, floor, supporting the patient for rehabilitation training, assisting patient with tasks such as toileting and bed repositioning. Patient lifting and transferring using the Maxi Sky 2 must be done by a trained caregiver, following the instructions for use. The Maxi Sky 2 series of ceiling lifts have been designed with a maximum lifting capacity of 272 kilos, or 600 pounds. The safe working load can be lowered to 200 kilos, 440 pounds, or 120 kilos, 265 pounds, to accommodate lower capacity rail systems. Movement controls. Moving the Maxi Sky 2 is achieved with the aid of the hand control, which includes all the command buttons to operate the lift. Vertical movement. The up arrow and down arrow buttons on the handset are used to raise or lower the patient. These buttons are also available for use on the control panel found on the lift. The raising and lowering functions accelerate gradually to prevent any abrupt movement as soon as the button is pressed, and remain active for as long as the button is pressed. The movement decelerates gradually to prevent any abrupt movement when the button is released. Powered Dynamic Positioning System, PDPS. If you have a Maxi Sky Powered Dynamic Positioning System, or PDPS, press the image of the laying person to recline the PDPS, and press the image of the seated person to raise the PDPS to a seated position. Quick Connect Overview. Quick Connect Lift, Spreader Bar, Scale. The spreader bar and scale features an attachment which allows the caregiver to change it in a few steps without using any tools. Align the spreader bar or scale Quick Connect latch to the hook. Insert the hook into the Quick Connect. Move the spreader bar or scale to engage the hook into the pivot. Make sure that the Quick Connect latch is closed. If using a PDPS, secure the base of the cable to the housing of the Maxi Sky 2 and connect the cable plug. The cable is connected between the lift and the spreader bar. There's no connection for the cable on the scale. Remove from Quick Connect. If using a PDPS, detach the cable from the back of the Quick Connect housing and then disconnect the cable. Open the latch that locks the hook in place by pressing it. Rotate the spreader bar or scale up towards the latch, depending on which one you want to remove. Move the spreader bar or scale to disengage the hook away from the pivot. Pull the spreader bar or scale downward, out of the Quick Connect. Attaching the sling to PDPS. Insert the clip attachment over the lug on the PDPS. Apply the leg clips of the sling onto the lugs, so that they become positioned vertically. Secure the clip in place by pulling the sling down, so that the lug is in the top portion of the clip hole. Detaching the sling from the PDPS. Pull the sling up to release the lock. Remove the clip attachment from the lug on the PDPS. Attaching a loop sling to a spreader bar. Place the attachment loop onto the hook. Make sure the loop is positioned correctly and that the safety latch is closed over the hook. Repeat the same procedure for all loops. Removing the sling from the spreader bar. Open the latch and remove the loop from the hook. Repeat the same procedure for all loops. Transfer a patient using PDPS and clip slings. Place the patient in the appropriate sling according to the sling's instructions. Ensure the positioning handle on the spreader bar is facing away from the patient, and that the open part of the spreader bar is at or just below your patient's shoulder level. Ensure that the powered DPS is lowered enough to be able to attach the sling's shoulder clips to the spreader bar. When ready to perform the patient positioning function, operate the PDPS control buttons on the handset to move the spreader bar into the required position. Once the PDPS is in position, attach the shoulder strap attachment clips to the sling attachment lugs on the spreader bar. using the hand control, lower the PDPS and attach the leg strap attachment clips. Lift the patient using the handset control and adjust to a comfortable position for transfer. Slide the ceiling lift away from the chair. The angle of recline can be adjusted for more comfort. When lowering the patient back down, use the handset to put the patient into a position that aligns with their destination. This minimizes lifting strain for the caregiver and ensures comfort for the patient or resident. The PDPS spreader bar enables patient positioning maneuvers to be performed with minimal physical effort by the caregiver. To stop any powered movement, release the control button. The spreader bar will remain firmly in position once powered movement has stopped. Transfer a patient using a 2-point spreader bar and loop slings. Ensure that the spreader bar is rotated into position before attaching the sling. When attaching a loop sling to the loop spreader bar, always ensure that the sling attachment loops are installed correctly into the retaining hooks. Use Arjo loop slings with a loop spreader bar. Using different loops will place your patient or resident in a more or less upright position. Use shorter loops at the head and longer at the legs to place your patient or resident in a seated position. Transfer a patient using a 4-point spreader bar and loop slings. When attaching a loop sling to the loop spreader bar, always ensure that the sling attachment loops are installed correctly into the retaining hooks. Use Arjo loop slings with the loop spreader bar. Emergency stop, red cord. This device is an easily and rapidly accessible feature, allowing the user to disable the lift completely in the event that an uncontrolled situation should happen. When pulling the cord, the lift stops all activities. The display and all indicators shut off. A small red plastic insert comes out of the casing. To reactivate the lift, push up on the red plastic insert. The lift is ready to use when the battery symbol or icon appears on the display. Emergency lowering mechanism. In the unlikely event of an abnormal situation, for example, an electrical failure, the emergency lowering mechanism provides a safe way of getting the patient down onto a chair, bed, or wheelchair. The emergency lowering mechanism is to be used only in case of an emergency. Pull the red emergency stop cord. Open the small side door to access the lowering mechanism. Pull the 8mm hex key from its storage compartment. Insert the hex key deep into the axle. Turn the hex key counterclockwise to slowly lower the patient. Once the patient is lowered and secured within a chair, bed, or wheelchair, call a qualified technician to inspect the lift. Additional features. The lift turns the display off to save energy whenever it's not being used for more than the configured time. Therefore, the Maxi Sky 2 must not be powered off after every use. The LED remains solid green to indicate that the battery's charge is above 25%, or flashing green if the lift is charging. The status LED turns to red when the battery's charge drops below 25% of their full charge. The lift will beep twice every 10 seconds when the batteries reach the critical point, less than 5%. The lift awakens every 15 minutes to display low battery messages and goes into sleep mode again after 30 seconds. Pressing any button on the hand control wakes up the lift. Cleaning the Maxi Sky 2 IC. Use a cloth soaked with water to remove excessive residues from the lift and its accessories from top to bottom. Use a damp cloth with warm water mixed with a cleaning fluid. Scrub the equipment from top to bottom to remove any deposits. Use a clean damp cloth with clear water to wipe off all spots of cleaning fluids. Then wipe clean with a dry cloth.